Dr. Shluper, let's talk about orthodontic work, which also, lately at least, it has advanced apparently quite a bit, and it's used a lot lately by adults to do cosmetic dentistry. So you don't need to shave down the teeth and then glue lumineers or veneers on it, and basically ruin the tooth, but just tweak them a little, straighten them out, and apparently there are methods out which go faster, better, and are not as cumbersome as the old day braces where you looked ugly and it felt uncomfortable. Tell us all about it, please.
Yes, I love to restore the cosmetic of the patient with orthodontics. We have the possibility to move the teeth, to preserve its integrity, not to file anything out of the tooth, just to move them. You
like that. I know you like it so much when you don't have to drill that tooth, and
to file anything from the tooth.
Yeah, yes. you just love it when you do not have to do any type of invasive operation. And I like that. I'm sure lots of patients like that. We're just so used today that everything we do to get rid of a cold, pretty soon they probably cut our nose off or something like that. I don't know. Do you know what I mean? But you have so much respect from the natural body, the things, the way whoever created us, let's call him God, and the way it got put in it, you have a lots of respect for that, and that's refreshing. That's beautiful. Go on. Sorry for interrupting you.
Yes, I love to straighten the teeth, to make them beautiful without having to cut anything out of them, and we can do that. We can have the teeth moved even with the patient does not see any braces. We can do it with clear braces like Invisalign. There are lots of companies, Invisalign and others, that allow us to move the teeth, and for adults that work the whole day and have to appear in front of people, while they're working, you do not see any metal in their mouth. It may be fine with the kids, but for adults we prefer to look at our best. That can be achieved.
So you're telling me that if, let's just say, I or anybody, some 30, 40-year-old guy who has a couple crooked teeth in front, for whatever reason, and maybe because he didn't take care of the braces when he had them as 19-year-old, and then afterwards didn't take care, so they went crooked again, or whatever the reason might be. If he takes your clear braces, your invisible braces, he can actually have a date or an interview with a big boss business person and have this appliances, this braces, this invisible braces in it, and the other person will actually not see it. Is that what you're saying?
It can be even a model on a podium walking as a catwalk, and she can have the Invisalign and nobody would notice.
Unbelievable. Unbelievable. All right, beautiful. So, what about in terms of orthodontic work and using it for cosmetic straighten out teeth? I'm sure it doesn't always work, because if I have a chipped tooth and heavy discolored tooth and whatever, then I still might need veneers and lumineers. I also might want them simply because I want it done today. I don't want to wait 4, 5, 6 months, which brings me to the question, is this new method which you're talking about here, these new braces, are they kind of faster or not really? It's just they're more comfortable, they're better to wear, and they're invisible, or are they also faster?
They are fast, but you should be ready to wear them for at least 3 months. That's usually the minimal time. You can resolve a very unsightly appearance in 3 months. You can move those teeth, you can straighten it. And we actually did it. Of course, if you do not have the time to wait those 3 months, there are solutions for that. You can have the veneer maybe that would be after that we would try to improve the appearance of the tooth just with the whitening. We can whiten the tooth without having to cut anything again out of the tooth.
Right. So let me ask you, let's go back to the, so we know that, there could be a combination, braces and maybe veneers. You maybe straighten them out, maybe still, and etc. But let's just, stay with the braces now. So a person puts them on. By the way, a teenager can wear them too, right?
Yeah, how do I hear you?
A teenager, a normal young person, 16, 18 years, who starts needing his braces, wanting his braces, whatever it might be, do those invisible, clear type of braces work for a teenager also?
Yes, they are.
Beautiful.
Yes, they are.
Beautiful. So tell me, I have, when you have those braces, I have heard that the old times of braces with the brackets and all that stuff, sometimes the braces work, but they're uncomfortable, unsightly. However, there is a problem. After a couple of years, when you take them off, next thing you know is that there will be gum disease there because it was so difficult to brush. Is that something with those braces? I have heard that it might not happen. Tell us why, if it is so.
Yes, the metal braces, they have the disadvantage that usually when you remove them, you would
maybe
get
this
cavities.
Is one of your emergency patients who wants to get dental treatment.
It might be, but I believe he will witness if he will need me, and I will call him back. Usually when we remove the metal braces, we would find a lot of cavities. We would find decalcification of the enamel. We would find things that need to be treated. Most of those things would be avoided and eliminated with the clear braces.
Because the clear braces, when he eats, he takes them out so he can brush completely perfect afterwards and then puts them back in. Is that what it is?
Yes. He would eat. When he is eating, he would take those clear braces out and then he would put them back. So the food will not be stuck in between the braces and will not cause any cavities. And the braces, those clear braces are invisible. So there is a lot of advantages in it.
Good. So yeah, because that looks like a big advantage not to get any type of gum disease, because you have mentioned in other videos how devastating gum disease really is. I mean, it's it attacks the liver, the kidney, the heart, has diabetes problem, fatigue, the immune system goes down. It's just really almost irreversible, because to fix those organs is a major task and it's difficult once they have been damaged. And all that from an infection in the mouth, and that maybe because you had a dental appliance. So obviously, it looks like you're suggesting teenagers and everybody to take the Invisalign if possible, because sometimes an Invisalign or a clear brace is not possible. Tell us about that. Sometimes it still does need the traditional braces, which, however, and you tell me whether I'm right or wrong, which did, however, quite drastically improve from like 20, 30, 40 years ago, right?
Yes, the clear braces are a very good solution when you have to move your front teeth, or not the teeth that are all the way in the back. For that, still the solution would be with metal braces. So in that case, yes, we would do metal braces.
Okay. All right. So good. All right. So that's about it. So the clear braces. What about if a person loses one of those trays he puts up? Let's just say he takes it down, eats, and for some reason forgets all about it. Or a child, steps on it even, stuff. What happens then?
Yes, if he loses that tray that he wears, he can come into the office and he will receive a replacement tray right at the same day. He shouldn't walk around without the current tray. So yes, we can replace that tray, so it's not the end of the world.
Right. And that brings me to another point, mainly probably with young people, but then again, I could probably qualify for that too, and that is, I start taking it out more than just for eating. I leave it out an afternoon here, a morning there, a day there. How dangerous is that? That's not good, right?
Yes, you should be wearing those aligners, they call it, at least for 22 hours a day. Do not wear them less than that. If you do that, if you do wear them less, you would prolong the extent of the treatment. You would need to wear them much longer. The time that would be required would be long.
Yeah, and that obviously is then not good either. All right, well, since they're so invisible that a model can wear it on stage, then I guess there's no really worry about trying to keep them out except pure laziness and whatever. Thank you very much, Dr. Shluper.
Thank you, Robert.